So I just wanted to share some tips really for telephone consultations. This is something that is becoming a bigger issue now that there are so many restrictions with COVID-19. And a lot of the clients that I'm working with, we're really having to think and to talk and to practice telephone consultations, because a lot of conversations that would have happened face to face are now having to happen over the telephone. And obviously this poses challenges when it comes to communication. So when we're speaking to people over the telephone, we lose a lot of that nonverbal communication. So it's really important to think, how can we communicate in the clearest way possible, in the most empathetic way possible? How can we show a relative or a patient that we're listening to them over the telephone? So there are some really important considerations. So I just wanted to share 5 with you today. 5 tips when speaking to patients or relatives over the telephone. And the first one is very simple. It's just to check that it's a good time to talk. And it sounds really simple, but it's really important, because when you're calling a mobile particularly, they could be absolutely anywhere, in a shopping centre, around a friend's house. And, particularly if it's a bit of a difficult conversation or you need to get information, they may not be an appropriate place. So just ask, after introducing yourself, checking you're speaking to the right person, just ask, is it a good time to talk right now? The second thing is, when you're on the telephone, you need to speak a bit louder and a bit slower, because obviously we lose the chance to lip read, to look at somebody's mouth when they're speaking, which can help with understanding. It's something that we do probably subconsciously, and we lose that over the telephone. So make sure that you speak a bit slower and a bit louder to make sure you're speaking really clearly. And the third thing is that there's often less disclosure over the telephone. And this is what the research shows, that people are less likely to disclose, to discuss problems, ask questions. So you're probably going to have to encourage this. And you can encourage this by using lots of open questions and empathetic statements, and by prompting. So you might have asked them a question, you might have asked them for some information, and they're less likely to tell you more over the telephone. So just use your prompts, use open questions. Can you tell me a bit more about that? Could you just explain what you mean there? Can you just expand on that? Give them the encouragement, the prompts to get the information that you need, and to encourage people to disclose, and also to share how they're feeling. So if you're giving difficult news over the telephone about a relative in hospital, and perhaps there's silence on the other end of the telephone, you can just say, can you just share how you're feeling about this? Or, I'm sure this is a shock to you. I'm really sorry. I'm sure you've got lots of thoughts going around in your mind. Is there anything you want to ask? So you might just need to encourage a bit more. And number 4 is showing that you're listening. So obviously, there's lots of ways that we can show people we're listening in face-to-face consultations through our nonverbal communication, but we don't have that over the telephone. Now, I don't know if you've ever had a conversation with somebody on the telephone and it's just silence, and you don't actually know whether they're there still. So I've had conversations like that, and I've actually said, are you still there? So it's important to show them you're still there and you're still listening. And you can do this by what we call back channeling. And this is just little phrases, little sounds like okay, as they're talking. Not all the time, but just occasionally, so that they know you're there and they know you're listening. And the last thing, really, well, two last things that I wanted to say, and that's that although we do lose a lot of nonverbal communication over the telephone, there is a really important part of nonverbal communication we don't lose, and that is our tone of voice. So over the telephone, utilising the tone of our voice becomes more important. There's a phrase that says you can hear a smile. And that's true. Even if they can't see you smiling, they will be able to hear it through your tone of voice. So use your tone of voice to show warmth, to show empathy, to show your attention. Okay? And then finally, you really want to check that the person has understood what you said, because in a face-to-face consultation, we can tell often through both verbal and non-verbal ways if the person is understanding, through their facial expressions, through their posture, okay? But we lose all that over the telephone. So you want to use questions to really check that they've understood what you've said. So at the end of the conversation, you probably want to say, could you just repeat back to me what we've discussed, just so I know that you fully understand? And then you get that clarity that, yeah, okay, they've taken in what I've said. So these are just some tips to really help you when it comes to telephone consultations. I hope these are helpful.